Public Health and Welfare, glad to see everyone this morning. Our first item of business is request for bill introductions. Do we have any bill introductions this morning? Seeing none, we will move on to our review of foster care services for the health and safety of children by Amanda Schlempberger from LPA. Amanda, thank you for being here. Welcome to committee.
Thank you, and thank you for having me. My name is Amanda Schlempberger, and I supervised this audit on foster care. And before I begin, I just wanted to provide a little background on the time period of this audit. We conducted this audit in the fall and winter of 2021 and presented it in March 2022. And the time period we looked at, most of the data will be October 2019 through about December 2021. With that said, the reason I bring that up is some of the information in here might have already changed, or there might already be some things that DCF has implemented, but we haven't followed up to confirm any of that at this time. So you'll hear me reference a few things that were supposed to happen, say, at the end of fiscal year 2022, but we don't have that information at this time. So with that said, I'm going to walk you through the audit. It's a pretty long audit, so I'm going to go kind of fast and just hit the highlights. I'll reference page numbers, but if you don't have the report in front of you, that's fine. I'll try to just give you the broad picture. This audit answered two questions. The first is, are foster care stakeholders following adequate policies and procedures to ensure the safety of children in foster care? And the second is, do foster care case management providers have sufficient capacity to provide necessary foster care services? So to begin on page 3, we found that DCF and stakeholders generally have adequate policies, but that they're not always adequately implemented to ensure safety. There's some brief background on page 4, which I won't go into. Just know that it's a complex system and there's a lot of players involved. For this audit, we focused on DCF and their case management providers. Speaking of, there are 4 case management providers and about 7,000 kids in foster care. And those case management those contracts began in October 2019, and they're scheduled to expire at the end of June 23. They are, St. Francis has 50% of foster care cases. Cornerstones of Care has about 10% of cases in the state, and then TFI and KVC have about 20% at the time of this audit. To specifically answer the question of the policies and procedures of safety of children in foster care, we first looked at placement appropriateness. And to answer this, we looked at the case management provider performance on several federal and state safety placement and well-being measures. You can see those results on page 11 of the report. A couple things here. DCF and its case management providers are meeting the federal standards for instances of maltreatment while in foster care. And then for the others that they're not meeting, it's important to note that these standards do not mean that children are necessarily unsafe or that they are not in the most appropriate placements, but performance on them may indicate process or capacity issues. For example, if a child can't be placed with a relative or kinship placement, keeping the child in their own school could keep them connected to their communities and families, and reduce overall trauma of the separation of being in foster care. The next area of safety procedures we tested begin on page 13 of the report, and this is routine in-home visits and safety assessments. DCF policy requires that visits between caseworkers and children occur monthly, and at least 50% of those monthly visits be in the child's placement. So to determine if case management providers were following DCF policy here, we did a random sample of 86 case files. These are not projectable. They were random and do not necessarily account for the entire population. But in those 86 files, we found that 29 cases had a visit where one or more monthly visit did not occur in the time period we reviewed. And DCF also does quarterly case reads, and they have found that visits are not always happening in their case reads as well. Many foster parents, we surveyed foster parents as well about monthly in-home visits. And many foster parents also told us that monthly work or child visits don't always occur. And at least 30 or almost 30% of the foster parents that responded to this question said that they had one visit, and many said they had 3 or more visits that were missed during the time we were asking about. Work or child visits are one of the main ways that case management staff monitor the safety of a child in foster care. A missed work or child visit does not mean a child is not safe, but it does mean that the child may be unsafe, and DCF or case management providers are unaware of that. Case management officials, staff, and stakeholders told us high caseloads, worker turnover, emergencies, miscommunications, and scheduling conflicts result in these missed work or child visits. And further, we found that case management providers do not always sufficiently assess the safety of a child in all cases during that monthly visit. As part of those monthly visits, the worker is supposed to assess the safety of the child. So in those 29 visits or 29 cases where a visit was missed, the safety of the child could not be assessed. And then we also found an additional 12 cases where the monthly in-home visit did occur, but based on the documentation, we could not determine that the worker had spent time assessing the safety of the child. And DCF has also found this in their own quarterly reviews, that sometimes the visits aren't sufficient to complete all the safety checks and risk assessments. Let's see. The next point that we looked at, stakeholders expressed concerns about communication and response in urgent situations. So we looked at communication and how DCF and case management providers respond to urgent situations. We found that DCF policies and grants set communication expectations. However, foster parents told us in the survey we did of them that they often were confused about who to contact, how to contact people, and that they sometimes don't get responses from a member on their foster child's team. Case management officials told us that communication breakdowns occur because staff is unavailable due to other job duties, or that foster parents don't know who to contact in certain situations. So for example, in an urgent situation where the foster parent could get a hold of a member of the child's team, there's the crisis response line that they can also reach out to, and foster parents might not always be aware of those different lines of communication. There's more detail on that finding on page 17 of the report. Briefly, on page 20 of the report, foster parent training seems to be match best practice and requirements, and foster parents reported to us that they were generally satisfied with the training they receive. The last safety issue, so the last part of question 1 that we tested were runaway and missing children from foster care. And children who are absent from foster care, research has shown are at higher risk of being sexually or physically victimized, engaging in delinquent behavior, using drugs and alcohol, or being victims of human trafficking. So locating these children quickly is a large safety concern. Under the new grants, again, those began in October 2019, DCF started a special response team. That's a 12-member team of DCF and case management staff that is solely devoted to locating missing children from foster care and preventing them from going missing in the future. Anecdotally, DCF and case management providers told us these positions have reduced the number of children running away from foster care, and increased recovery rates and shortened the time children are missing from care. We were unable to confirm this because there wasn't reliable data from the previous grants to compare current performance to that previous performance. But there's more detail of that on page 23 of the report. Briefly, some contributing factors to our findings include caseloads, use of data, and DCF oversight. So many case management staff told us in the survey we did of them, we surveyed foster parents, but also we surveyed case management staff as well. So many case management staff told us that high caseloads make it difficult to comply with DCF policies on child safety, and I'll discuss that a bit more later on. Data issues could also be a factor. DCF has a system, the CareMatch database, which is supposed to address issues of case management providers not having access to information on all the homes available in the state. However, case management staff do not always use this CareMatch system when making placement decisions because their own systems, they told us, are more robust and they're able to make more informed decisions. Further, CareMatch doesn't necessarily speak to all the individual systems, so they have to manually put everything in. So the data in CareMatch is only as good as what gets put in by child placing agencies and the case management providers. Further, even though this data exists and also other data, DCF and case management providers don't always use it to make management and performance improvement decisions. So DCF hasn't always had firm or used firm oversight and corrective actions. This was something we identified in previous audits we've done as well. Case management staff told us that that has started to change, and DCF in the fall of 21 started performance improvement plans, and those reviews of those plans with case management providers occur quarterly. Those were due to end in fiscal year 2022. At that time, DCF officials told us they would assess and consider penalties or other actions. All right, so switching gears to question 2. This begins on page 26 of the report, and this is to remind you whether foster care management providers have sufficient capacity to provide necessary foster care services. And we found that the state does not have sufficient capacity to provide services to all children in foster care, especially those with specialized needs. To start, we looked at the current available licensed homes in the state. Overall, the state has enough licensed foster homes for the number of children in care, but those homes may not always be in the locations needed to keep children close to their home communities. So on page 28, you'll see we did an estimate of capacity of each county in the state. To do this, we looked at the homes available in each county and compared that to the number of children who would need foster homes in each county, accounting for children leaving care and also children placed with relative or kinship placement, so they wouldn't need a licensed foster home. Our estimates found that 39 counties in the state are either over, at, or close to capacity. And if you view the report on our website, you can see the analysis for each county. But in terms of what's in the hard copy of the report, that's page 28. The map shows the 19 counties that we estimate would be over capacity. All right, even if the counties have enough capacity, we found that stakeholders told us the state might not always have enough homes to care for the children with complex emotional and behavioral needs. So these children, best practice, say need to be placed with highly trained foster families. And based on our survey results and stakeholder interviews, we were told that the state may not have those higher capacity or higher needs homes available in the training. At the time of this report, DCF did not have any sort of professional therapeutic foster parent program option. Those are programs that other states use of highly trained foster parents who can care for these children and keep them in a family-like setting as opposed to ending up somewhere else. There's more of that on page 31. DCF at the time of this audit did say they were exploring those programs. All right, on page 34, you'll see we did some analysis on caseloads, as I mentioned earlier. DCF grants require that case management providers have caseloads of a maximum of 30 foster care cases per caseworker. However, we found that best practices can vary, but are generally recommended to be 12 to 18 children per caseworker. We looked at those caseloads for each of the case management providers and found that they're generally meeting the DCF standard, although they do get higher at times. However, again, that DCF level is over recommended best practice. Case management providers told us caseloads get higher than they should be because of staff turnover and staff shortages. This is occurring, they said, because of low pay, long hours, and general burnout among caseworker staff. High caseloads make it difficult for caseworkers to do their jobs, including providing services as well as monitoring safety. There's more detail on what we found from case management providers in our survey of them on page 35, and some detail on what they reported to us in their comments on how caseloads affect their ability to do their jobs. At the bottom of page 35, you'll see some measures that DCF and case management providers have instituted to try to increase recruitment and retention. For mental, behavioral, and specialized health, we looked at what case management staff, stakeholders, and foster parents reported to us in terms of capacity, sufficiency, and availability of those services. There's not any aggregated data on what services all the children in foster care need and what services they're receiving. So that data is all, or that information is all kept in individual case files. So we weren't able to necessarily give a large picture, but we can report what we found in terms of what was reported to us via case management and foster care providers. The case management providers are responsible for coordinating the services needed for the children on their caseloads. And the reason I mention that is the case management providers, unless they have a grant, are not necessarily providing the services directly. They have to work with KDADs and community mental health centers, schools, and other local providers to find the services for the children on their caseload. And then they make referrals. Across the state, we found children aren't always receiving the services they need, especially with specialized or acute services. And DCF has also found this in their quarterly case reads. And then we found that foster parents reported difficulties and delays over getting children with complex physical, emotional, and behavioral needs. The specialized services they required, they also required or reported to us it taking a long time to get those services once they did get them. A significant number of case management staff also commented on the difficulty of getting specialized services for those children with complex needs. For example, PRTF or psychiatric residential treatment facilities have very long wait lists, and those have been difficult to access. And there's more information and specifics of that on page 38 of the report. And much like service delivery and capacity issues, much like safety issues, are part of larger accessibility and coordination issues. We found that there's capacity and coordination barriers to getting these services. So caseworkers reported mental health providers not having staff to meet the needs of the children on their caseloads. For example, PRTF beds have increased in the state, but staff to maintain those beds and have children in them have not. So the wait lists for PRTF have gone up, despite beds going up. Also, case paperwork and requirements that need to be filled out and filed can be a barrier. They can take a long time to get filled out and all of that. And then also, all foster care children are on Medicaid, so they get a Medicaid card, and that insurance can be a barrier because some local providers, especially in rural communities, don't want to accept it because there's a delay in getting payment and they can't afford to have that delay in getting payment. And then stakeholders and case management providers also indicated a lack of cooperation, collaboration, and communication between agencies. So as I mentioned, there's a lot of agencies involved. There's DCF, and the case managers have to coordinate with KDADs and local providers. So there's lots of areas where communication can break down or confusion can occur. Page 40 of our report lists some service and coordination efforts that DCF has undertaken to try to address some of these concerns. You'll also see on page 41, we have some larger conclusions about the continued issues we've seen in our audits about the state's foster care safety, oversight, and service capacity issues. 42, we had some recommendations for DCF around capacity, safety, and oversight. Their responses are also listed. They're generally favorable, and many of them they were in the process of implementing. And then finally on page 44, you can see DCF response, and then also TFI, KVC, and Cornerstones also submitted responses that you will find in the report. And with that, I'm happy to answer questions.
Thank you, Amanda. I imagine there's going to be a lot of questions from this report. So committee, if you would indulge me, we'll do one question each with follow-up so that we can ensure that everyone has a chance to ask them questions, and then we'll circle back as time allows. So with that, committee, questions for Amanda. Senator Petty.
Did you say you wanted to just take one at a time? Okay. Thank you very much for the presentation. It's pretty comprehensive. You had mentioned on page 17 that the training for the foster parents was good, that the ones that you surveyed responded that it was good. So, but I'm trying to understand how the foster parents are responding that their training is good, but then they're also responding that they don't know how to access care. How does that go together?
We didn't specifically look at their training in terms of responding to services and getting those children to services. But in terms of what case management providers told us about coordinating those services and foster parents getting children to those services and knowing what's going on, one of the issues that they mentioned was staff turnover. So when because caseworkers can change so quickly, sometimes the foster parent isn't notified that, hey, this changed, or this provider or this caseworker is no longer on the case, and that information doesn't get updated and carried forward to the foster parent always. Again, that sort of root cause of communication and caseloads comes into play there. But ultimately, the case management providers coordinate the services. So the foster parents are responsible for getting the children in their care to appointments, but not necessarily having to find the services themselves. Does that answer your question, or is it getting there?
I guess it reflects the fact that there's always going to be this somewhat of a disconnect. I mean, yes, the parents the providers have the child, and they are saying they're getting good training, but you're also saying that because of turnover of staff, which this is not new news, and is not going to go away. It has a big price tag attached to it too. But that because of turnover of staff and access to resources, then there's still that problem out there, even if they're saying they have good training to be a foster parent.
Yes, I think that is accurate.
Thanks.
And I would say that in our survey of the foster parents, many of them, I think it was about 75% said they had appropriate training, but the training that was missing, that was reported in that survey to us, was for those more specialized needs. So that 25% where they didn't think they had appropriate training.
Senator Holscher?
Thank you, Madam Chair. There's a lot of information here in regard to high caseloads, which obviously is an issue that contributes to potential burnout of staff leaving. The one thing I'm wondering is, through the audit, did you arrive at a number as far as what our deficiency is in number of caseworkers? Maybe it's in here and I just haven't found it.
We just looked at caseloads from, I'm trying to remember, I think it was through June of 2021. And those are monthly reports that DCF submits. And we didn't do any analysis on how many caseworkers are needed versus how many caseworkers we have. But based on those monthly reports, caseworkers are meeting DCF requirements, but best practices are significantly lower. So DCF, at the time, their grants said 30 maximum, but best practices from various organizations recommended more between 12 and 18. And we didn't also look at licensing and the type of training that caseworkers have either. We've done that in the past. We didn't do it in this audit. And then also those caseloads sometimes get significantly higher. I think at times they were more like 40 cases or children per case manager before they evened out again and got back to that 30 level or lower. So.
Thank you. Yeah, and I mean, I see improvements from where we were in 2015 in various areas. I was just, like I said, maybe one of our other stakeholders can help us determine, how many caseworkers we really need to get us more in that best practices area. Thank you.
I do have a quick question. Is it unusual that we don't have aggregate well-being outcome measures? Is that typical, or is that unique to Kansas?
When you say aggregate, are you talking about the services, or are you talking like well-being, like the federal measures?
I thought I heard you say that we have just the individual data, but not aggregate
Right.
well-being outcome. Is that unusual?
So we have DCF collects and reports well-being measures to the federal government in various areas, but in terms of actual services, that's not aggregated anywhere and not tracking what a child needs based on their individual needs and what they're receiving and who they're receiving it from, like what provider. DCF and case management providers told us that would be very difficult to track because children's needs are changing. They're changing foster homes or placements, so it's hard to track that. As far as if it's unusual compared to other states, we didn't look at other states, so I can't speak to necessarily what universal best practice would be on that regard.
Thank you. And as it relates to best practices, it looks like overall you found that DCF has adequate policies. The difficulty is in the implementation, and a lot of that points to having not enough case managers, not enough staff to do that. That seems to be a long-standing problem, to Senator Petty's point. What are some unique or innovative solutions, or are there any, that DCF is pursuing, or anything that you find that maybe the legislature could do to help that? Because we can't continue to have this problem. So did you examine that at all in your report?
We didn't do an in-depth analysis of that, but we found certain things like one of the things that stood out was therapeutic foster homes. And what that does is it keeps children with high needs in a family-like setting, but it also frees up some of the pressure on the service capacities. Those children often end up in the PRTFs and other types of facilities. So if they can stay in a family-like setting, a therapeutic or professional foster parent setting, then that frees up space in those facilities for other children who may need it at a higher level. So that was one of the things that stood out to us. And then as far as other solutions, I think DCF has told us multiple things throughout the report. I just can't recall them right now off the top of my head, but DCF has been researching and conducting inquiries into some of those other solutions, and they may be able to speak to that more and answer that. But otherwise, we are happy to do some research on that as well for you.
Thank you. Other questions? Senator Baumgartner.
Thank you, Madam Chair, and thank you so much for your presentation. I'd like to guide us to the charts that you have there on page 11, where it talks about federal guidelines and where we are. And I want to focus specifically on the same school placement. So the federal guidelines is that more than 25% of school-age children attend the same school as prior to removal. If I'm understanding your chart correctly, KVC has only 12% of their kids are placed in a foster home where they would attend the same school. All the way down statewide, we're at 18%. So 18% of those school-age kids are attending same school, but all of the rest, I'm going to look at it the other way. We have 82% that are not. Is that correct? Am I reading that chart correctly?
That is my understanding as well.
Okay. And I think that that has a direct correlation with concerns that we have heard from foster parents in that children, particularly the older age kids, are leaving, running away because they want to be with their cohort. They want to be with their friends. And so I do know, when we look at KVC, TFI, and cornerstones of care, as an example, 18%. So those kids are missing because many of them might be in Wyandotte County and they're being placed down in Sedgwick County. And those become runaways because they are not only moved into a new home, but they don't know anyone. They know no one. And do you get any indication from DCF what they're doing to change that?
DCF and case management providers did tell us that when children run away from their foster care placement, it is usually to family and friends. So that is one thing they told us about why these are occurring. And as far as what DCF is doing to prevent that, with the new contracts that began in October 2019, they instituted that special response team. And that team, not only they have standards and they meet best practice as well in their policies in terms of like how they're supposed to track down children, looking at family and friends connections, social media, those kind of things are all things that team are dedicated to. But then once they find a child, they also do an assessment with the child after they're found to understand why they ran away, what happened to them while they were away, and also what they work with that child to try to prevent that from happening again. So it's really that special response team and their policies and efforts. And like I said in the report, I can't speak to the effectiveness of that because I didn't have the data to make that comparison.
But nothing from DCF with regard to same school placement?
We did not ask them about that.
Madam Chair, if I might, as a follow-up, You know, it's interesting because the federal government does allow for agencies such as DCF to claw back or to penalize contractors that aren't meeting federal standards. And yet you indicate in the report that that is not something that DCF is doing. And we do know that the Child Welfare Oversight Committee has heard that there, at no time have we clawed back or penalized any of the contractors. Are you familiar with at what level other state agencies, similar agencies might do that clawback? And I see that the rationale for DCF is, well, they have put all of their contractors under a performance improvement plan. And yet we're still not there. We're not seeing those changes that we need. In fact, I don't know if this committee knows, but we have nearly 500 fewer foster families than we did 2 years ago. So fewer families, kids are being moved away from their schools, and we're not doing any type of clawback. Did DCF indicate anything where they're showing improvement by not penalizing as opposed to what other states are doing? It just is interesting to me that the federal government very specifically allows for that to occur, and yet we've chosen not to. Thank you, Madam Chair.
Oh, they did not indicate their rationale there. I don't know if they have since, because they told us that they would be looking at those performance improvement plans at the end of fiscal year 2022. So I'm unsure what DCF has done since that time. And I'm not aware of what levels other state agencies are using in that regard.
Senator Blasey.
Thank you, Madam Chair. Help me kind of clarify some questions that were kind of mentioned by Senator Baumgartner. So if a child is in Johnson County, what are the likelihoods of that child being moved to like Wichita or somewhere far? I mean, if I'm looking at this map given here on page 6, it appears that the 4 providers are divided across the state geographically. And so it looks like KVC is covering Johnson, Douglas, Shawnee County, et cetera, whereas St. Francis is covering Sedgwick County. So is it true that kids are being placed in different communities by different, based on this graph or this map you have here?
I can't speak universally to that or even the likelihood. We didn't do that work, but one reason that DCF told us that kids would be potentially placed, say, from Johnson County in Wichita or vice versa, would be lack of homes available, lack of homes that meet the child's need if the child has a high behavioral need or something like that. And then also, the goal is always to place with family or kinship first. So sometimes children do get moved out of their community to go with, say, a grandparent or something like that. So that does occur, and there are reasons that it may occur. Another reason we looked at was the issue of child placing agencies. All of the case management providers also have child placing agencies, and that's what we were looking at with CareMatch. How does this work? Are certain case management providers favoring certain child placing agencies, and child placing agencies sponsor the foster homes? And I believe there are, I can't recall off the top of my head, so I won't give you a number, but close to 20 maybe child placing agencies in the state. So there are lots of options and homes that are sponsored throughout the state. But because CareMatch isn't necessarily working the way it was intended, where it could be this universal database that, say, Cornerstones of Care gets a kid with these needs, they can go to CareMatch and say, I need a home with these needs. Are there any from any of the child placing agencies available? And it's not necessarily working that way, but we didn't find any evidence because we didn't necessarily do the analysis on the rates of where kids are placed in terms of their removal home versus placement home. We have done that analysis, I believe, back in 2017. So it's a little dated, but there is some audit evidence out there in that regard. But I don't have that off the top of my head right now.
If I may, so you said, you know, if child need of care is being given to a kinship, like a grandparent or something, the state still monitors that child, even though they're with family?
That is correct. They should still be having those monthly in-home visits and such.
Wow. And so St. Francis Ministries has 50% of our children in their care, yet they cover, other than Central County, it appears to be more of the rural parts of the state. Is a lot of those cases that St. Francis manages it primarily in Sedgwick County, or do we know? Because, I mean, they have 50% of the kids despite the population being on the eastern half of the state, based on this map again on page 6. Where are most of these kids located, I guess, primarily? Is it Sedgwick County?
Yes.
Thank you, Madam Chair.
Senator Thompson?
Thank you, Madam Chair. Thank you for the report. There's a little nugget down here on page 51 that basically says we have, and that was from the KVC response, that we have reason to believe that up to 50% of the children currently in foster care in Kansas can be safely served at home. You know, out of the 6,500, that would reduce the caseload significantly. Could you speak to that?
I can't speak to any specific numbers because that was outside the scope of our audit, but I will say that that is one, and this I think speaks to an earlier question that came up. One thing that DCF and case management providers have told us, they have really focused on family first efforts and keeping children in their home, which again would reduce some of those caseloads and capacity issues if kids never enter foster care. So that is what they told us, but I don't have any analysis on the numbers that KVC provided.
Okay, thank you. Thank you, Madam Chair.
Any other questions from Madam Chair on that? Okay. Senator Holscher, yes, we're ready for round 2. So if you have other questions, let's go.
Great, thank you so much. You know, interestingly, on that point of kinship placement, I know there's been a focus by this body as far as the legislature, as well as overall emphasizing to try to place children with relatives. Yet I will say that I have a friend who is a practicing attorney in regard to adoption law, and she has indicated that her focus is more so keeping the child in the community, because if you already have the disruption of being taken away from parents, then taking them out of their community and putting them somewhere else sometimes causes more trauma. But, and like I said, you know, maybe that just kind of goes, that's different than what we as a body seem to have been talking about the past few years as far as placed with a relative first. So maybe we need to think a little differently in that regard. But my question comes down to, it's on page 28, and bless you, whoever's sneezing out there, where it talks about extremely difficult placements. And I know we are seeing an increase as far as behavioral issues. Are we seeing any best practices or any direction you can point us into as far as what's making the most sense on extremely difficult to place children?
I think DCF and the case management providers would probably be better equipped to give a more informed answer to that. But I will say what came up again was the therapeutic professional foster homes, just really having that trauma-informed care that those families that can essentially make foster care and caring for these high needs kids almost more of a job. Again, that professional foster care home idea came up, but as far as more informed, I will leave that to the child welfare experts.
Senator Petty?
Thank you, Madam Chair. Earlier on, you've mentioned about, I think it was on page 28, not enough homes available in some counties. And so I had a question about that. So when you looked at not, and one of those is mine, Wyandotte County, when you looked at not enough foster care homes available in a county, was that in relation to the number of children from that county to match up with the foster homes?
Yeah, that would be to keep the children within at least their home county. So that's how we conducted that analysis. And they're estimates, so they're not like firm numbers, but that was one of the things we looked at.
And I think it's rather interesting, as was mentioned earlier about, and I noticed as I was looking through the report that DCF has made a goal, well, the family first, keeping them in the family, as Senator Thompson said, about they're using that as a tool to work with families to help keep children in their own families, as that's being the best place. But with kinship care, they've increased it from 29 to 50%. But then that brings that issue, which has been brought up about not being able to stay in their own community. So then that lays another layer out there with when that is an effort that they're making as well. So it looks like these efforts for Family First and kinship care that DCF have laid out as being, which are best practices. Do you see those as, in their report, as moving in the right direction?
Kinship care we didn't dig real close into it because it was a bit outside the scope of what we were doing here. But if I recall correctly, the numbers are trending towards that 50% goal, if I recall the data. So,
thank you.
Senator Baumgartner, then Senator Blasey, and that will probably take up the remainder of our time. So Senator Baumgartner.
Thank you, Madam Chair. I would like to share with the committee that one of the things that we've heard repeatedly from foster parents is that children with very complex issues, be it physical issues, social, emotional, mental health issues, oftentimes they're placed in the home with the foster family not knowing how complex those issues are. So they don't have a heads up when they get that child. We've also heard, even though there is to be a physical and a mental health, a complete evaluation within the first 30 days of placement, that has not been happening. So I think that makes it very difficult for our foster families. I am curious, we've heard for several years now that part of the problem, in fact, one of the recommendations is that DCF should conduct a service capacity study to determine. And in fact, when you look at some of the line charts that you provide, the one that's on page 34 with the maximum cases per case manager, you'll see that they all exceed best practices. And yet it's the contractor that bids. This is an RFP, a bid process. So that contractor entered a bid to be providing this service to the state of Kansas. And so we don't have enough, but I am curious because DCF has told us repeatedly, and when I look at that recommendation for conducting that service capacity study, we have heard from DCF that part of the problem is their technology, and the programming technology that they have is outdated, very similar to what we've heard, what we did hear during the crisis of COVID with the Department of Labor. So did you hear any response from the agency as to how they're moving forward as far as that new software and new programming to help them actually track where all the kids are, track what those percentages are as far as caseload for the different contractors? And am I just not seeing this in here where they address that?
I am not fine. I know it's in here. I can't point you to the exact page right this second. But they are, at the time of this audit, they were conducting a feasibility study to start the bidding, I believe, a feasibility process on sort of a universal case management system that would address some of these data problems and IT system type problems that were mentioned in this report. I can find the page number for you.
I think that would be helpful, and I think it's important for this committee to know, because I've had folks reach out to me saying that they've looked at the governor's new proposed budget. They don't see funding request anywhere in there for that. And every single month that we march forward, that we're not getting a program updated, it is continuing to, I would say, misalign us with the agreement we have in our class action lawsuit. Thank you, Madam Chair.
Final question, Senator Blasey.
Thank you, Madam Chair. This is a quick question, but I know our goal is obviously reintegration. Obviously, we want to keep families together. We want to keep children and sibling sets together. But here it says 78% of placements are sibling sets, but 22% are not. And I know sometimes it might be because of behavioral issues or some conflicts among siblings. Do you know specifically on the 22% that are not placed together, is it because of that? Is it because of there's some conflicts, or is it because they just of requirements in terms of capacity, they couldn't keep families together, sibling sets together?
I don't have any specifics on that, but based on what DCF and case management providers told us, it's kind of a combination they try to keep siblings together when it's in the best interest of the child or the siblings. And they approach every case on an individual level. Is it best to keep them in their home community with their siblings? Is it going to be in the best interest based on their needs to get them in a PRTF or something like that? So it's very individualized in that regard.
Amanda, thank you so much. I would just like to personally thank our foster care caseworkers, all of those families, the schools who are taking these students and opening their homes, their school doors, their church doors to these children. And we have an obligation, I believe, all of us, not just legislators, not just those people working in this area, to ensure that those children are safe and loved and have what they need to succeed. So thank you for the report. Committee, we will meet tomorrow, and seeing no other business, we are adjourned.